No, I thank you. That's nice for.
Yeah.
Hello, everyone. It's Danita Chantel, and welcome to another episode of Bella TV. Today, we're here with Bella Magazine's very own medical advisory board head, Dr. Demesmin. How are
Hi, I'm
you?
doing good. How are you?
I'm
Thanks for
doing
having me here.
fantastic. I'm doing fantastic. Now, the last time we spoke to you, we talked about pain management. And today, what are some of the things that you would like to discuss?
So we're going to be discussing headaches, actually, just because headache is actually a very big problem in the U.S. and actually around the world. There's about more people suffering from headaches than back pain, actually, which is actually a big problem. So there's a lot of nuances to headaches. So it's very important to distinguish exactly what headaches are, and when to recognize a headache as being a problem and to seek medical help from it.
Okay, so we're going to talk a little bit about headaches now. That's like the number two thing in behind chronic pain, as far as chronic back pain. Now, you specialize in pain management. Why would someone call you if they want to talk to a doctor? Like, what's the difference in your specialty as opposed to a general practitioner?
So essentially, a pain physician, we deal with patients with pain, acute and chronic. So acute pain is actually something that we expect to get better over the course of a week or so, but chronic is something that persists for a long period of time.
Oh, I see.
So anything that feels abnormal, whether it's like a pain to the abdomen and to the back specifically, so it's very important to seek medical help just because it can signal something bad is going on.
Okay, so why are headaches so common?
So headaches are common, I think, just because of general population. So headaches are actually there's over like 5 billion people on this earth, and a lot of them actually suffer from headache. Part of the reason can be because of migraine. It could be because of things like there's a lot of stress that occurs, and a lot of times, sometimes you can get headaches coming from your neck actually. So a lot of people carry heavy bags. Sometimes you have secretaries that on the phone they put their heads along those ways, and it can cause headache actually.
Oh, I see, I see. So who is most prevalent to getting headaches? Like you mentioned, people walking down the street with heavy bags or us on our cell phones, but can you answer that question?
Yeah, so majority of headaches actually come from females actually. So there's like probably like a 2-to-1 ratio of patients with a lot of female compared to male that have headaches.
I have an idea as to why that would be with us. Probably menstrual cramps would be one of them, and also back pains related to childbirth and things like that, maybe exercising. What is the most important thing everyone needs to understand about headaches?
So the one thing is like if you have a headache that presents every day, and sometimes if it presents with nausea, vomiting, and also with visual changes, meaning that if sometimes the light bothers you, like you hear like abnormal sounds, so that usually indicates there's something bad going on. So sometimes it can be a migraine, but sometimes headaches can also be a sign of like of God forbid a tumor. So if you have a headache that presents on a regular basis every single day, you have to seek medical help. Sometimes you're gonna get a headache just here and there. You take Tylenol, it goes away, so nothing to worry about. But if it presents every single day, then you have to seek medical help for it.
Oh, wow. So you just mentioned different types of headaches, and what is the difference between a headache and a migraine?
So migraines actually fall under the category of headache, but a migraine is actually like a medical condition, meaning that it's going to present with signs like visual disturbance, meaning that the patient is going to have disturbance of light. Sometimes the light's going to bother them. Sometimes noise is going to bother them, and sometimes they'll come with nausea and vomiting, and sometimes it's going to feel like on one side versus the other, and it's going to feel like toothpick. Sometimes just like you have like an ice pick directly going to the back of your eye. So these things are actually signs of migraines. And when you have a migraine, you have to see a neurologist or somebody like myself to be able to take some special precaution just because it can turn into something bad. So it's very important to make sure that you treat it accordingly.
Oh, wow. So it's not just going to get over the counter medication and then taking a pill and then take two pills and call the doctor in the morning. With the migraine, you have to see a specialist like yourself.
Absolutely.
Wow, wow, interesting. Is there any new technology that exists to fight any migraine pains?
Yeah, actually there is. So there's actually something we do called a spinal cord stimulator. So it's actually like it's a little bit like a. I'm not gonna go
Sounds
too much.
intense. Like
Yes.
spinal cord stimulator. Like
Yeah, so for patients who have like what we call refractory migraine, because one of the options is to take a lot of different medications, but sometimes they can have a lot of side effects. So there's like a lot of science technology that are invented specifically to help with patients with chronic migraine. So it involves using like an electrical device that can place directly into near the head actually just to help reduce the intensity of migraine. So, and the good thing about it, you don't have to take a medication for a prolonged period of time, which can have a lot of different side effects. So it's a bit technical, but I'm just giving you just like a brief highlight of what that
Oh, okay.
is.
Well, how long would a procedure like that take? Is it an office visit, a outpatient visit where you don't have to stay overnight in the hospital or something? Like, how long would that take?
Yeah, these are outpatient procedures. Like it can
Outpatient
take
procedures.
about 30 to 45 minutes to be done in the office to be able to get to feel better.
Wow, wow. So, as far as us keeping ourselves healthy, and I feel like headaches signal some type of stress going on in the body. What can we do as far as eating to prevent headaches or making sure that we're taking care of ourselves?
The simplest thing is to stay very well hydrated because a lot of time if you're dehydrated, it's gonna cause headaches as well. So make sure you have about 10 cups of water especially during the summer because like when you sweat, you lose a lot of fluid and sometimes it can actually give you headaches. So make sure that you always stay hydrated and eat vegetables and fruits and things along those lines. Sometimes some food have like a lot of acid and that can actually cause pain. So make sure that you use like a lot of food, like avoid like hot dogs. I think that'll process. So just use like vegetable, green leafy things. Not as good as whatever else.
The burgers and the fries and all the salty foods and
Absolutely.
well, summer's coming, all the cookouts, so grab some veggies and take that off the grill.
A cauliflower burger.
Yeah, yeah. Vegan burger. Yeah, you can add the toppings on that. So you mentioned a lot of ways that we can be aware of our body signaling us through headaches, and
Uh-huh.
like you differentiated between migraines and headaches, and not just taking over the counter medications just to cure everything. Like don't self medicate. How do you help your patients that have headaches and migraines, other than that technique you mentioned earlier? Like,
So one thing like meditation actually helps as well, but sometimes
oh,
like you can actually get up in the morning
yes.
and do meditation. And sometimes if you do have a headache, so take some time, just like do some nice relaxation technique to make it go away. Because sometimes in times of stress, you can sometimes feel like the blood rushing through your head and you feel like pounding.
Right.
But if you just like close your eyes, you just like take a deep breath at times, it's just like simple techniques that you can do.
Wow.
And sometimes you just walk around like a lot of people, a lot of my patients, they're always on a computer
Yes.
staring down,
Yeah.
and that causes a lot of stress in the cervical spine and the neck. So sometimes getting up, walking around, and just like stretching, and then going back to what you're doing, and make sure that you exercise on a regular basis. I think these things are simple things that can be done to help restore like a good active lifestyle.
Well, you mentioned eating well, staying hydrated, making sure we take care of our posture, not straining ourselves. And something like common in practice now.
Absolutely. Like a lot of times, the first question I ask them is like, what do they do with their necks? Just because a lot of
It's like,
headaches come from the cervical spine, so to make sure that they do like some exercises that can get their neck stronger, but also to avoid things that will get the headache going. All right.
yeah, yeah, awesome. Well, you have three practices. You stay busy. Is some of the the techniques you mentioned, is that like covered by most insurances, or is that something that you offer just for people that want to try something that's a little bit not the regular techniques for treating patients with headaches?
Yeah, like a lot, the insurance cover what we do, but
Good.
there's certain things like acupuncture. Sometimes insurance don't cover that, but
Yes.
everything that we offer for the most part insurance cover. But a lot of time, if something is not covered, but we work with patients because we
Awesome.
are physicians first. So
Yeah, taking care of
yeah,
everyone, and the holistic approach is important. You know what I mean? It's
yeah, no,
very, very
absolutely.
important. Wow. Well, can you talk to us a little bit about your practices? Like, I know you have three practices. You're a busy man,
Hmm.
but obviously you take care of yourself to meet the needs of your job. Like, talk to us about your practices.
So our main location is actually located in New Jersey,
Yes.
but also have a practice in New York and also in Florida. So as an interventional pain practice, we see patients with what we call acute and chronic pain, mostly like cervical, neck, and back. And we do a lot of things with what we call regenerative medicine. So we use like the patient's own body, like the stem cells to help the patient heal. And we use a lot of advanced techniques like minimally invasive surgical procedures where we use small little instruments to help reduce a patient's pain. Like if you have a disc that's pressing on a nerve, one of the options is to get a big surgical operations like to reduce the problem, but we can actually do it using like small instruments to do the same thing. So we specialize in using the least uh, the most effective technique to help and the least invasive technique essentially.
Wow. So you're on the cusp of moving forward with a lot of your procedures and staying busy. And I feel like we need other alternatives. Like thinking about back surgery, it seems intense. No one wants to go in for that, be out of work for months. But like you said, there's outpatient procedures that you can do and different approaches to treating people with headaches or
Mhm.
chronic pain. So I think that that's very informative and it helps us have some options.
Yeah, no, absolutely, for
And,
sure.
my last question to you is, what do you feel about when we go to the pharmacy and take over the counter medications as far as for headaches and like the ibuprofens, the aspirins, like those are helpful, but can you give some words about that?
Yeah, I mean, I think it's okay to use like things like acetaminophen, Tylenol, or ibuprofen, but not on a regular basis. And especially make sure that you don't have any other medical problems that would prohibit you from using it. For example, if you have high blood pressure, you have to be careful about taking anti-inflammatory medication just because it can worsen your
Oh,
blood pressure.
got it.
If there's anything with liver issues, make sure that you limit the amount of Tylenol that you use just because it can affect it. So I think like always do it with the recommendation of a physician as opposed to going there and grabbing a lot of things to use.
Wow. Well, Dr. Demesmin, tell us about your website where we can find out more information and tell our audience.
So the website is www.upmcnj.com and www.upmcny.com.
Wow. Well, guys, tune in next week. We have learned a lot about Dr. Demesmin and what he offers for us as far as solutions with having headaches or migraines or just understanding how to take care of your body better. Make sure you tune in next week. Follow us on social media. Please like, share, and subscribe. And remember, Bella, beauty defined by you.
Thank you.
Thank
Thank you
you.
very much.